remember that this opportunity that you have is a gift from God. Hundreds, thousands of people wanted to do medicine, but only you are one of the few who are chosen. Not necessarily because you are good in that, but God has chosen you. And each of the person's studies training is because of the teaching of so many people and the sacrifice of so many people, their money. That's how we are trained. So the training that we receive, what you have learned from our patients, we must give it back to them. We must give it back to the people, to the nation, to God. So whichever field you're going to choose, always remember, don't think of it as a sacrifice, but you are just giving back what you have received to the people and to God in gratitude.
Hey friends, welcome back. How many of you recognize this voice? Well, if I were to introduce this person to you, I would say that he is a perfect gentleman. He is a veteran in the mission fields, and let's see what he has to say about being a psychiatrist in a mission hospital. Well, guys, thank you for coming back, and this is 2021, and we have a very special guest with us today. Is Dr. Susheel Tharien. Dr. Susheel is a psychiatrist. I should say that he is a veteran in the mission fields. He's been working in a mission hospital for almost 40 years. So that's a really, really great achievement. That means he'd be having a lot of experience. And we're going to talk to him today. And thank you, sir, for spending time with us. And giving us this opportunity to spend time with you. Dr. Susheel, so even though you've worked in Mission Hospital for 40 years, you've almost lived your entire life in a mission hospital. Isn't that right? So please tell us how was it as a boy being in a mission hospital, and and how was it during your school days?
Okay. This mission hospital was started when I was 3.5 years old. And now the founders, they were particular that it should be indigenous. We should not depend on any foreign aid. And also that we should be with the people with whom we are working. So as much as possible, he felt that we should identify with the people. So when I went to school, all the school, we are in a village school. So all the children went without chapels. So my father said, you also go without chapels. So I went, first standard, I went. But then when I came back for lunch, it was so hot, I came running and crying. And my father had gone to the hospital. So my mother gave me her chapel. So I wore my mother's chapels and went to school. And later on, then my mother told my father. And then finally, I think I got some chapels to wear. And later on, the quarters where we stayed was quite far, about 1.5 to 2 kilometers away from the school. So we had to walk in the morning. We carried our lunch box and walked all the way and came back. It went on for some time. Then my grandmother came, and she was very upset that the grandchildren are made to walk so long. So she arranged for a horse cart and all that is Kudirabandi. So we went by that for some time. Then that horse cart, they used to come late, and we were late for school. Then that didn't work out. We are back to walking to school again. We didn't mind that much. In a way, it was good. We learned to walk a long distance. So I had no problem walking long distances later on when I grew up also. So I studied in the local school in Tamil medium. Then I studied in the nearby town, Dindigal, which is a little better school, again in Tamil medium. Only we didn't feel anything different, except when we used to go for summer holidays. to our grandparents' place when my other cousins who were city bred would come there. They'll come with their comics and all that they read, and here we could not read any comics, and they'll have to translate it into Malayalam and then explain to us. These are some of the times, and they'll be talking to each other in English, and we could not talk. These are the only times we felt that difference of not having studied in a city. Otherwise, I didn't feel anything very different. And of course, when I went to college, it was all in English medium, and initially I had a lot of trouble adjusting because of the language problem. But that was there for maybe for 1 year. Then I picked up talking to others, and then now I'm even thinking in English now. So all these things really didn't matter in the long run. That's what I would say. Yeah.
That's quite interesting. Like that's if you look at many of people who have been raised in a mission hospital or in a mission field, people who are students or children, they don't go back to the mission field and work. So how was it different for you? How did you decide to spend your whole life in a mission hospital?
Yes, having lived through here and hearing from my parents about the what work they are doing, and studying with the children of the same village, I became aware of the village conditions and the need and the poverty of the people. So I always wanted to be with them and help them. If not here, some other place. In fact, initially I worked with the leprosy mission. I was sponsored by the leprosy mission. So after my MBBS, I worked for 3 years in Andhra Pradesh. And I in fact stayed in the leprosy hospital, and that hospital had no other staff. So doctor and ex-patients only were there. We stayed with them, and the entire life was there. And nobody was around there, only the beggars who were our patients. So beggars were our friends actually. So when you go in the bus, many beggars will come and beg. When they saw me, they'll just stop begging and they greet me and go. And I always liked dealing with these people. So I thought after I finished my obligatory service, I must work in another leprosy hospital or some needy area like that, or some other mission hospitals. That's what I felt. I had never felt I should go abroad or go to any city and work. Maybe because I would have felt out of place in those places.
So, so how did you come to decide on Oddanchatram? Is it because it was a familiar place, or did you choose Oddanchatram specifically for a specific reason? How was your thought process when you made that decision?
As I said, actually, I didn't think I'll come back to Oddanchatram because I felt, okay, I've seen the hospital growing, and now it has become that time around 200, 250 bed hospital. I thought maybe I should go and work in an even more needy area somewhere. And I thought maybe either in Andhra or somewhere in Tamil Nadu, which is more needy. And because I worked in leprosy hospital, I thought I must look for a leprosy hospital maybe. Then when I was working in leprosy hospital, I came and talked to one of the senior doctors here and had lunch with them. And that's when when we talked, we realized that there is a need for us, for the second generation to sustain the work that was started. The work was started from a very small beginning and has come to this stage, but we need people to sustain it also. So we felt, okay, that's also a need. I thought, let me just come and work for a few years and see. So that's how after I finished my obligatory service, my wife, by the time I got married, my wife and I came here to work. And as we were working, we realized that we fit in well here and maybe we are needed here more. And it's been a gradual conviction only. It's not a sudden revelation or anything like that. Gradual conviction as we worked here that maybe God wants us here with all our involvement and our work. That's how I came to be here.
So it's been almost, when you joined, it would have been almost like 35 years before. So even now, many people must be searching Google Maps, where is Oddanchatram? So how was it that time? Can you just give us a picture of how was Oddanchatram when you came back from Andhra?
Yeah, when we came back, Oddanchatram had grown slightly. The main road was there, railway station was there, and a few buildings here and there, a lot of trees on the road. Still, patients were very poor. People would ask for concession and so on. Not like what it is now. I think there's been a big change now. I don't know when this change started, maybe 10 years ago, 15 years ago, I don't know. Suddenly, a lot of development. Not only Oddanchatram, I think all over India, there is the economy has come up. And, in those days, there used to be every Saturday, there used to be a stream of beggars come begging. Today, you can hardly see a beggar. So things have changed. Yes, there are still poor people. Still, there is a need is there, but not as much abject poverty as it was in those days.
On psychiatry. So that is quite a strange decision being in a mission hospital, because almost everyone in a mission hospital would want to be a surgeon or a physician. And that too so early in those days. I'm sure psychiatry, there have been very less takers. So how did you decide on psychiatry?
I was always interested in general medicine, and I thought I'll take up general medicine. And in fact, somebody suggested, I came back here and worked as a junior doctor in the Department of Medicine, hoping to, if possible, specialize in general medicine. When somebody asked me whether I would consider psychiatry, I thought, oh no, I will also become mad. That's what I thought at that time. But I spent 2 years in general medicine because I thought I should prepare myself a little more. In the second year, a psychiatrist, a missionary psychiatrist, a British missionary psychiatrist from Noor Manzil in Allahabad, she came to visit us. The junior doctor was to go with her and collect patients and then translate from Tamil to English for her. So each case that she saw, I was the one to translate for her. And I found it very, very interesting how quickly she made a diagnosis and how quickly she suggested treatment and started treatment. And every evening she would take classes in psychiatry. I found it very fascinating. And that's how my interest in psychiatry came. Even then, I thought I was in two minds whether to take up medicine or psychiatry. I applied for both. I was only in waiting list for medicine, but I had gotten for diploma in psychiatry first. Then I thought, okay, maybe I'll do my diploma in psychiatry, and then I will again try for general medicine. But once I started psychiatry, within 3 months, I really liked it, and I didn't look back afterwards. Then I had no doubt. I realized that this suits my temperament, and I found it very interesting. And I thought I always liked talking to people, so it really I was really interested in this. And then it is not so very competitive, not you're not on your toes all the time. So I liked all that. So I continued psychiatry, which I really enjoyed. I enjoy it even now, till now.
That's very true. Psychiatry is a wonderful field, especially how you kind of make a diagnosis even without touching a patient. And a lot of it deals with the mind, right? So it's really, really fascinating. And you said you were very interested. So do you remember any particular patient or any particular incident which brought more fascination in psychiatry?
Now, it's not really any particular patient. Whenever I used to examine a general medical patient, and when I used to examine the abdomen, I put the patient on a bed and examine. That's the time I talked to the patient. And I found that many medical patients really had no medical problem. They come with abdominal pain or something, but I realized that they had no medical problem. When I talked to them, I realized they had a lot of problems, other issues in mind. And I liked talking to them, and just that I didn't know anything how to give therapy and all, psychotherapy. I did not know. I just only talked to them. And many of the patients were very happy that I talked to them. So that is so my interest in this talking to people. Okay. Then as a junior doctor, those that we are posted in surgery and so on. While most doctors want to take up every chance to do surgery, and those days, two doctors will be there. One will be cutting up, the other person will be at the head end, either giving local anesthesia or giving, those days open draw breather or talking to the patient. I like that part, talking to the patient rather than the surgery part of it. So I was always at the head end, talking, consoling the patient. It will be over in a short time and so on. So I realized that I like this talking it's more, and I wish if I had some training in psychiatry, I can help people more in dealing with their problem. That's how my interest in psychiatry came up more.
Now, sir, you have been in this field for almost 3 decades, more than 3 decades now. So how has it evolved? Is it psychiatry as a field, and what do you, how do you see it in the future as well?
Yes, I feel every patient who comes to hospital will have a psychological component to their illness. Even if a person comes with a fracture, he'll be worried about the fracture. What will happen? How long will it take to heal? What will happen to my family? The psychological concern will be there for any patient, whatever their specialty. So I think every doctor should be able to deal with that aspect along with his own specialty as well. So it's not just the role of a psychiatrist to see every patient. I feel every doctor should have some input into psychiatry so they can really help the person, not just heal the bones or tissues, but the whole person will be able to deal with. So that's one thing. Now, psychiatry is a developing field, more and more research in various areas, like in any other medicine, it's developing. But I feel 80% of psychiatric problems can be dealt with by any doctor who has some interest in psychiatry, who can be trained a little bit to deal with some other common problems. I feel 80%. It's only the 20% who may need really a specialist's intervention. This is true for any field of medicine. They say 80% of the problem are primary medical care problem. It's only the 20% which needs a secondary, tertiary care intervention. So I feel there needs to be a psychiatric input into every field in medicine. And other thing is that many places the psychiatric treatment is expensive. So for a small problem where patient needs counseling, probably it may be quite costly. I can see that even my nearby town, about 30 kilometers from here, the psychiatric treatment is very expensive. So for a mission hospital, I feel we should offer these services at a reasonable, low cost, because it doesn't. We're not spending anything much by way of material or equipments. So we can see more number of people at a lower cost, and we can help a lot of people. And many times I feel because the psychiatrists are not that many, like in physicians or pediatricians, not many. So many people, they don't get a good psychiatric care, even in towns. So I feel mission hospitals should develop psychiatric service so they can help people who come to them and get treated. Even in a developed state like Kerala, I feel in some of the mission hospitals which have got psychiatry department, they are really helping a lot of people than private practice in psychiatry or in any corporate hospital.
And one of the things about the field of psychiatry, especially if you are in a rural place, is that many of them are treated by people who are quacks, or sometimes they go to religious heads. Some of them are being treated as being demon possessed. How was it in those days, especially because you were working in a rural area? And how did you deal with those patients?
See, initially when I started, I would get maybe about 5 patients who would come directly in a day. If I get 5, it will be a big number. And it used to be mostly what is referred by doctors from other departments. And the people did not know, they're not aware that there is something called a psychiatry or a mental health. Why should I go to a doctor for the problem in my mind? That's what people used to think. But that has changed now. Now there's a lot of awareness, maybe because of the TV and so on. People's awareness of psychiatry is much, much better now. So there's a lot of change from the earlier days to present day. But the problem, what is there even now, is that people expect quick cure. They want to be well within 5 days, which may not be possible in many psychiatric treatment. It may take a little longer. So unlike in many psychiatric centers where patients stay for 1 month and so on, I don't think anybody can still stay for 1 month in a mission hospital, at least here. So what we do is we don't admit people unless it's really necessary. And we admit only when they cannot manage them at home. And admit them and make them a little manageable at home so they can go home and continue the treatment at home. Then they, once they're able to take the tablet by themselves. So usually our stay is only maybe about 10 days. That's all. Or maybe even less. So manage the acute condition, difficult condition, and discharge them as early as possible so they can be managed at home, which is cheaper for them, and patients are also happy. Why should they stay in the hospital? They're happier staying at home. So these are some of the differences, I would say, from the usual psychiatric practice outside and in a mission or rural mission hospital. And even among Christians, people think that every psychiatric illness is probably a demon possession. Because anything that they cannot understand is of the devil. That's how people think. That need not be so. In fact, most often it is not so. Anyway, when you read in the Bible, there are people who are possessed by demons, evil spirits. They not only had psychiatric problems, there are people who had presented with epileptic seizures. There are people deaf and blind. And Jesus drove the spirit of deafness and blindness. So, but somehow we think that only behavioral problem only is an evil spirit. So we should not simply assume that every abnormal behavior is a spiritual problem. And like one of our professors of surgery used to tell us, a missionary, if you hear hoof steps outside your door, you're more likely to find a horse than a zebra. That means you must think of more common conditions, not a rare, relatively rarer conditions. So common problem of abnormal behavior is a psychiatric illness. That's what one should think of first. And then we can think of the other possibilities of other causes. Even villagers also, usually they first go for some magical treatment and then only come for psychiatric treatment. But the awareness is better nowadays, so more and more people are coming directly.
So those days, did you have any interference by maybe godmen or like other people who would come to the hospital and maybe perform magic or black magic? Did you have any instances like that?
No, I have not had that kind of experience. But I had people, patients coming and telling that they went for some prayer and they told me, no need to take a medicine, only prayer is enough. That kind of things we have had. So people have discontinued medicines and they had a relapse and come. That has happened. But coming here and interfering, no, that we have never had.
Okay. So one of the things which you have done in your career is a very interesting thing which you have done is you're probably the only psychiatrist probably in the whole wide world who also does gastroscopies. I'm not sure if any other psychiatrist does scopies. So please, for our viewers who do not know this, Dr. Susheel went to Japan and learned gastroscopy. So, sir, if I'm right, Japan is one of the best places to learn gastroscopy. Is that right? Their lenses are, their cameras and lenses are really good. They're probably the best in the world. And so please tell us about that experience and why you actually, being a psychiatrist, learned scopies.
Well, on a lighter vein, when people ask me, why is the psychiatrist doing an endoscopy, I would ask them, haven't you heard that the shortest way to a man's heart is through his stomach? Say anyway, it is, both are really not related. As soon as I finished my internship, I had the opportunity to go to Japan. I received a scholarship from one of the good universities in Japan to learn anything for 3 months. They would give that scholarship to come there and learn, and they paid me a stipend also. So Sebi, you said rightly that endoscopy was developed well in Japan at that time. So I thought maybe I can get some training. There is something which we didn't have at that time. Even Vellore, it had just started only. So I opted for that, and I went there. I had 3 months of training in endoscopy, the early days, 1979, 78. And when I came back, they even gave me a second-hand, their discarded endoscope. They sent it by parcel here. So I started with a second-hand endoscope, and later on we bought our own endoscope, and nobody else to do endoscopy, so I started doing that. And of course, endoscopy has now advanced so much in India, and now almost all surgeons are doing endoscopy, and gastroenterologists are there. But I continue to do that. I did over 1,000 endoscopies afterwards. But I did psychiatry after I came back from Japan, so both are not related at all.
Okay. So, sir, another one of your the things which you routinely do is marriage seminars. So, is it part of a problem which you identified in the community because you were a psychiatrist? Please tell us how you got interested in that.
Yes. See, as I'm in a mission hospital as a Christian psychiatrist, people used to refer to me, many mission organizations, when they have people with problems. So I have seen a lot of people who have gone as missionaries who also had a lot of problem with their marriages. I was really saddened, surprised to see the number of missionaries had problem in their marriages. So, and then once they develop a problem, it takes a long time to really counsel them and get it right. Sometimes it's very difficult. I wished, they'd only learn how to prevent this problem a little early in their marriage. They could have avoided all these things. And I had an opportunity to attend some marriage seminars. That is not for treating marriage problem, but how to enrich your marriage. And I found it was quite helpful for us. And I thought it's a very good thing. If only we can learn this, people who start their marriage, who have good marriages, can make their marriages even better. One of the things we learned was that marriage is like a garden. Unless you look after your garden, weeds will grow and the garden will not flourish. Our garden will not grow automatically. We really have to work at it. So I wish that many of the Christian workers, missionaries, and this, they should learn how to enrich their marriages. That's how we started this. My wife and I were both interested in that, and we attended this marriage some programs here, and we were invited to Finland. In fact, in Finland they've been having a marriage enrichment seminar for the last 40 or 45 years, and that really has reduced the divorce rate in Finland among those who attended this course. And the divorce rate was nearly 50-55% in Finland. Among those who attended this marriage seminar, the rate dropped from 55 to 11%. And the Finnish government was so impressed that they wanted to promote their YMCA to conduct this program, and even wanted to invite foreign people who are doing marriage seminars to come and participate and observe this. So that's how my wife and I got invited, in fact, by the Finnish government to attend this marriage enrichment seminar, Christian marriage enrichment program. That is also very helpful for us, and putting that few of these inputs together, we started conducting marriage enrichment program, a 2.5-day program for couples, not those with problems, but good people with ordinary marriages, to come for 2.5 days in a place they can stay together and go through this interactive program. Not much of lectures, but interactive. The interactive means not we interacting, the couples interact with each other. And many other couples found it very helpful. That's how we are conducting. And sometimes we get invited, sometimes in Delhi, once in Bangalore, and once in Kerala, and so on. So if we get invited, we go there and we conduct for them.
So, sir, one of your hobbies is music, right? Music is something which almost everyone in Oddanchatram associates with you. And so, shall I ask you, which is your favorite instrument? I know that you play so many instruments. So, which is your favorite one, and which is the most exotic instrument which you know how to play?
No, I'm just an amateur. I like guitar. That's my favorite.
Okay.
Though I wish I'd learned to play piano or an accordion or violin or something, but I don't know. I play guitar mainly. I started with playing this bulbul and harmonium. And then later on, when I went to college, I was really fascinated by the sound of guitar and that you can play and sing together. Other instrument you can either play or sing, not both together. So I was interested in this, and I learned in my first year. I bought a second-hand guitar for 50 rupees, and I started learning, observing others, and I continue to play that during our prayer group and meetings and so on. So I still continue to play that. My guitar I have is probably 40 years old. I still use that. Yeah, I don't know any exotic musical instruments. I used to play one baby accordion.
Okay.
Maybe the exotic that I have, nothing else.
So one of the things which you regularly do is teach the students and especially the nursing students how to sing in a choir. And almost every December you have a choir in Oddanchatram, and many of them have not even sung in a public place, and they come and then they learn these songs, and it's one of the spectacles and something to look forward to in Oddanchatram, the choir. So how was it? How I know it would have been quite difficult to train all these nurses, and so tell us about that experience in Oddanchatram.
Yeah, in school when I was studying in Evangelical, I used to sing in the choir there, and that was my first introduction to English music and church music, hymns and so on. And when I was studying in Vellore Medical College, I used to sing in the choir, and I always was fascinated by this 4-part harmony. How I was not used to that when I was in school here in Oddanchatram, but in fact, initially when I heard this people sing in different parts, I thought people are all singing wrong. Only one person is singing right, I thought. Then I realized, this 4-part harmony is something that I began to appreciate that. And I always thought when I finished Vellore, oh, this will never happen in Oddanchatram. Here I hear people, they sing only in the, like Indian music only. But then I always thought, could we try the singing in parts, in 2 parts or something like that. Then as an experiment, we tried teaching some of the people who could sing in parts, and many times we failed. It used to be horrible sometimes. People don't know how to sing together. But sometimes we succeeded. So we continued to try that, and fortunately we had sometimes once in a while people who know some music. We had a lab technician who knew to play violin, and he brought in some good Christian Christmas music, and we taught them. Initially we sang only in unison. Then as a trial, we tried singing in parts, 1 or 2 songs in parts, and the Lord trial with people who had never heard this kind of 4-part music. But we persisted with that. And then I had this ambitious thought. My greatest ambition was where we could sing the Hallelujah chorus. I thought that can never happen in Oddanchatram. But still, that was there, my dream. But one Christmas, we persisted, tried for nearly 1.5 months, and we sang it. And my my mother was good in music. She likes singing. She was a good singer. I wanted my mother to hear that. And my mother was suffering from cancer, and she could not even come. But she came. Somehow she came for that, and she was there for that. And it's a matter of great joy and satisfaction for me that we could sing that Hallelujah chorus when she was there. She passed away the next year. And then we continued to sing that. And so I thought, no, even though people have never heard singing, by sheer practice, even if you don't know music, but simply practice, people can sing. That's what we found. So every year, that's what we do. We practice every day for about 1.5 months, and the same part practice, and people are able to sing. So our choir has maybe about 60 people. Maybe not even one of them have ever sung in a choir before. But just practice, and then we are able to sing. So it's really a joy and a matter of satisfaction. We are able to sing songs in harmony for Christmas time. I wish we could sing every week, but it will require a lot of practice.
Thank you so much, sir. So to conclude, if you'd like to say one thing to whoever is listening to you, maybe a medical student or somebody who's considering missions, who's interested in psychiatry, what would you say to them, and anything which you would tell them specifically?
Yeah, first of all, I would like to tell any medical student that remember that this opportunity that you have is a gift from God. Hundreds, thousands of people wanted to do medicine, but only you are one of the few who are chosen. Not necessarily because you are good in that, but God has chosen you. And each of the person's studies training is because of the teaching of so many people and the sacrifice of so many people with their money. That's how we are trained. So the training that we receive, what you have learned from our patients, we must give it back to them. We must give it back to the people, to the nation, to God. So whichever field you're going to choose, always remember, don't think of it as a sacrifice, but you are just giving back what you have received to the people and to God in gratitude. What about psychiatry? Since there's a lot of misunderstanding about psychiatry. Psychiatry, from what I've said so far, you would have learned that it's an important, integral part of any branch of medicine. And if you can just learn a little bit about psychiatry, how we can deal with some of the problems, we'll be doing a great service for the people. Simple thing is just listen to the patients. Or if you are in a busy OPD, at least allot 10 minutes of your time to a chosen 1 or 2 people to listen to them. Okay, you can leave the others. At least you select 1 or 2 among the crowd. Please wait, I want to talk to you. And not that you want to talk, you want to listen to them. If you just listen to them, 50% of them will get better just by your listening. You don't need any special skill to talk. People are longing for someone with whom they can share, with whom they can unburden their problem. That itself will solve 50% of the problem. So you can help a lot of people. And if you feel inclined to take up psychiatry, please do. You'll be helping a lot of people.
So thank you so much, sir. And to our viewers, thank you for tuning in. And we hope to see you in the next video. So bye.
Bye. Thank you.